We would like to welcome now our speakers, Ozge Karadag Caman, research scholar from the Center of Sustainable Development, Columbia University, and also Yanis Amor, Executive Director of the Center of Sustainable Development at Columbia University. Thank you so much.
Thank you so much, Florencia. And I want to thank the SDSN for giving us an opportunity to speak. So my name is Yanis Amor. I'm the Executive Director for the Center for Sustainable Development, and my colleague, Dr. Ozge Karadag Caman, and I today will discuss how COVID-19 is going to affect migrants and refugees and our proposed response. Next slide, please. So I would like to first reposition our problem within the context of the Sustainable Development Goals. For those of you who are not familiar, there is no Sustainable Development Goals relative to migrants and refugees. So we are going to shape it with SDG 3, good health, and SDG 10, reduced inequality. Next slide, please. So for those of you who are not familiar with the SDGs yet, SDG 3 is about ensuring healthy lives and promoting well-being for all at all ages. And SDG 10 promotes reduction of inequality within and among countries. And I want to remind everyone that most inequalities are human-made. Next, please. So we have noticed an unfortunate increase in global numbers of international migrants, and it continues to outpace the growth of the world's population. The number of international migrants globally reached an estimated 272 million in 2019, which is an increase of 51 million since 2010. Currently, international migrants comprise 3.5% of the global population, which compares to 2.8% in the year 2000. Next, please. So forced displacements across international borders continue to rise, whether it is due to the war in Syria, the instability in Venezuela, or African migrants trying to reach a better life in Europe. There has been an increase for the last 10 years. So between 2010 and 2017, the global number of refugees and asylum seekers increased by about 13 million. Next, please. So the virus itself does not discriminate, but social determinants of health do. And here are some of the examples of social media messages from humanitarian organizations that we found that were trying to raise awareness on the situation in refugee camps. So you cannot hashtag stay home if you have none. You cannot hashtag wash hands if there is only one water tap for 100,000 people and no soap. And you cannot hashtag avoid crowds if you live in a refugee camp. Next, please. So migrants and refugees are disproportionately affected by the COVID-19 pandemic. Some countries report that the number of fatal cases of COVID-19 is unproportionately higher in some migrant group. And there are problems in primary, secondary, and tertiary prevention. And my colleague Ozge is now going to walk us through those.
Thank you, Yanis. So as you all know, international migrants are a heterogeneous group with both labor migrants and forced migrants, but in this presentation, we mostly would like to focus on forced migrants. And when we look at the problems in primary prevention, we see that poverty is one of the biggest problems because many of the migrants need to continue working under risky conditions for the infection. There are also problems with accessing healthy food, and we know that many of the forced migrants have nutritional deficiencies. There are problems with shelter and living environments, such as cold weather, overcrowded tents, or houses with 4 families living in the same household. And we also know that especially in camps, there are long queues for food, water, shower, which create problems with social distancing. So now we know that authorities are banning even 3 people to play basketball in outdoor spaces, but they also expect tens of thousands of refugees to implement social distancing measures in overcrowded camps. We know that there are problems in accessing water, soap, and sanitation, and also stress-provoking factors are also very important because for migrants, again, the level of uncertainty is higher, and there's increased stigma and discrimination, increased hate speech, and increased violence. Because many people tend to blame that migrants, many people tend to blame migrants for this outbreak. Next slide, please. Can we have the next slide? So we also know that there are problems in access to reliable COVID-19 information and problems in access to information about available services. There's lack of personal protective equipment. And we also know that many of the outreach and work of NGOs and other institutions, as well as many asylum interviews and services for migrants have paused during this outbreak. We also hear that some countries deport migrants who test positive to their countries of origin. So in summary, physical, mental, and social problems affecting they all affect the immune system and increase vulnerability of migrants for the infection. Next slide, please. When we look at the problems in secondary and tertiary prevention, we know that there are difficulties in accessing COVID-19 testing. There's lack of proper quarantine and isolation opportunities. There are problems in access to treatment, and there's absence of surveillance and lack of data about migrants, especially for undocumented migrants. Next slide, please. So, no one should be left behind. We know that social determinants of health are strongly linked to how the COVID-19 pandemic evolves. And vulnerable, disadvantaged groups with respect to social determinants of health, including migrants and refugees, should be on the agenda of policymakers and service providers for a comprehensive and effective COVID-19 response. Next slide, please. We know that health and well-being of migrants and refugees are not only important for migrants and refugees themselves, but also important for health and well-being of host societies, human and financial resources of host societies, and also for controlling the pandemic at the global level. So we need to remember that, especially during outbreaks of communicable diseases, none of the people will be protected if we do not include everyone. This means we're all in the same boat. Next slide, please. When we review key interventions to control this pandemic for at the global level, depending on the size and characteristics of the camps and immigration detention reception centers, we should be thinking about either evacuating the centers or camps or reorganizing them. Quarantine and isolation places need to be prepared, especially in the camps or centers, and reorganization should also include protection of more vulnerable migrants, such as elderly and migrants with chronic diseases. We should also be distributing hygiene and sanitation kits. We should train the staff working at the camps and centers. We should be suspending all public activities, restricting number of visitors, and we should check new arrivals for fever and other screening symptoms. Also, of course, maintaining good sanitation is a must. Next slide, please. There are also several interventions that we can be implementing for all migrant, refugee, and displaced populations, and these are adequate supply of personal protective equipment, linguistically and culturally appropriate health education, and risk communication. So, for instance, production of informational materials in multiple languages will be very important. And we should have effective outreach approaches. So we should be involving community leaders, cultural mediators. We should be using hotlines, social media, or mobile health technologies to reach out. Next slide, please. Universal health coverage is very important. Access to testing and treatment, regardless of legal status, is very important. And also, field hospitals and mobile clinics can create significant difference. So although few members, some countries actually announced that they will treat asylum seekers as permanent residents, allowing them to access public services during this outbreak. Decreasing stigma and discrimination, especially via media tools, is very important during this outbreak, and community participation. So involvement of migrants and refugees in planning, implementation, and evaluation of COVID-19 related policies and practices is important. While implementing these interventions, of course, intersectoral collaboration and sufficient funding, resource allocation will be important. So cash transfers will save lives, especially for migrants and non-migrant people who lost their jobs during this outbreak, and for families who need financial support. So in summary, next slide, please. All countries need to have a human rights-based and inclusive approach that leaves no one behind to control the COVID-19 pandemic and to promote health at the global level. In this respect, international organizations have a very crucial role to guide countries and to show them the best practices. We should remember that inclusion of migrants and refugees in all policies is also crucial to achieve SDGs. Thank you.